This is Sean Huang with Sapien Psychiatry. Today we'll be discussing neurotic depression. Neurotic depression was a diagnosis used before the DSM-3. Neurotic depression was defined not by specific symptoms, but by its course. Neurotic depression is often less severe, accompanied by anxiety symptoms, and a chronic rather than episodic course compared to unipolar depression or current-day major depressive disorder. Those with neurotic depression can experience brief periods of worsening symptoms during stressful periods. In 1980, with the release of the DSM-3, neurotic depression was excluded. This was a significant change, with many clinicians being reluctant to let the term go. To compensate, new diagnoses were created, including generalized anxiety disorder and dysthymia. These were meant to capture the patients who were previously diagnosed with neurotic depression. Other patients were recategorized into major depressive disorder. Now that neurotic depression was removed from the nomenclature, clinicians had to adapt to the new categories. As a result, many patients who would have otherwise been diagnosed with neurotic depression were now being diagnosed with these conditions that would call for antidepressant treatment. The lack of definitive diagnostic clarity has resulted in antidepressants being prescribed for those with neurotic depression, even though psychotherapy would likely be the ideal treatment modality for these patients. Thank you for watching. If you found this to be informative, please like, share, and subscribe. See you in the next one.